I am Nikieta Lambert. I am the Training and Curriculum Specialist for the Armed Services YMCA Child Development Center, and I live in Chesapeake, Virginia. The economy was still reeling from the Great Recession and the housing market that kind of imploded in '08. And so in 2012, I was just looking for a job and I helped someone to open up a school. And I just fell in love with learning, with children, the art and science of it, seeing the light bulb moments and how I could help support families. On the parent side, I'm able to, because of some of the knowledge and experience that I have, I can navigate some of those like challenging or bumpy phases a little more gracefully and peacefully than I would if I had never entered the early childhood education field because I know what's developmentally appropriate. If I had never gone into this field, I wouldn't know what it looks like to develop autonomy. I wouldn't know something as simple as many times young children struggle with positional words like in front of, behind, beside. So if I ask my child, hey, come stand beside the chair, and if he's just staring at me, I don't think he's ignoring me. I know I need to show him what beside means because he just doesn't know what that is. So it doesn't eliminate my frustration, but it does help to reduce it a lot. And then on the educator side, it's definitely made me so much more empathetic and understanding of family struggles because I can relate. I can relate with the frustration. I can relate to feeling helpless and overwhelmed, being tired. It makes me less quick to be so critical, like, oh, why don't they read with their child? Why don't they do this? And I know, like, there's bedtime, there's bath time, there's bills, there's phone conversations, there's all of these things. And then also, it's made me more keenly aware of how much shame there is in parenting and how easy it is to be embarrassed about whether it's your child's development or their behaviors. And so, since becoming a mom, I really put a lot of care and effort when I interact with families to let them know that there's no need for shame here. The two main things. One, everything is shutting down. We don't know the extent of how contagious this is, how detrimental this is. We don't know the ins and outs of it yet. We just know the world is shut down. And for centers that did not shut down, on one hand, you're grateful to still have an income, but it's terrifying. Am I gonna get sick? I'm gonna have to take that back to my family. We're being told at that time to have children social distance, but these children have no concept of personal space. They're dropping their masks all the time. They're exchanging masks. They're touching faces with masks. They want to be close to you. They want to be close to their friend. You're trying to wipe everything down. Then, on a functional level, for the really young children, you're teaching them how to form words and sounds with your mouth. How do you do that if they can't see your mouth? How are they going to see you smile? Are your eyes happy enough to comfort them? So it's terrifying, it's stressful, it feels like an uphill battle, almost impossible. And I will say, at least from the people that I've spoken to, it was a little challenging going in and doing all of this work all the time and consistently being left off the group of people who were thanked as essential workers. Quality, loving relationships are so beneficial for everyone, children, adults, senior citizens. Um, and there are just so many systems that need major reform in order to support this. And there are just so many things that prevent that security and the ability to have quality leisure bonding time. This is not exaggerated at all when I say that access to these programs and these supports can very well be the difference between life or death. And it's not just about the ability to get a vaccine or have illnesses cared for, but When you are stressed out about being able to afford medicine for yourself, a parent, a child, when you're stressed out about are you going to have somewhere to send your child to be cared for? Are you going to be able to afford food? That amount of pressure and lack of support is unfortunately the perfect storm that we lose too many families to. That can result in abuse that comes it stems from the stress and overwhelm. It could be neglect, and then unfortunately, it could even mean family elimination. So I'm very fortunate that currently my family won't be immediately or directly impacted. But to just kind of piggyback off my last response, the cut of these supports just adds an immense pressure, and amount of stress to families, and so I just think you just have to ask what happens when people's basic needs cannot be met. There's already such a struggle trying to encourage parents to engage with their children more at home and in beneficial, meaningful ways. How much less is that going to be able to happen now that they have to worry even more about food? Or if they're going to be able to continue having somewhere to send their child or Medicaid, just so many things. There's just so many things to worry about in the field and helping families for over a decade. And when it was time for me to sign up for some of these services, the other like last year, 2 years ago, when I was going through a really stressful financial time, separation and divorce, I had to do a lot of research and a lot of asking for help to know where to go, what some of this meant, what form goes with what form, and then who do I talk to who and when, and this is for specifically for this, and this is similar to that, but it's for this, but don't get them mixed up, or you could be accused of some sort of fraud or trying to get over. Um, and so it's just challenging. And don't even get me started on the verbiage that's on some of these forms and these websites, the applications. It's not very user friendly. Um, the websites, the portals, the applications, the processes, it's overwhelming. If I had a hard time as a college graduate, an educator, an avid reader and writer, how many other people are going to struggle with access? Just because someone tells you what website to go to or an address to go to an office and connect with someone, that does not equate to access if you don't know what to do once you get to that site or that office. We can first acknowledge that about 28% of childcare workers are covered by Medicaid. And so if they lose access to that, either one, they're going to seek employment elsewhere where they could possibly get some sort of insurance, or two, they're just gonna be absent more because they're sick and they can't come into work and they don't have access to healthcare to help them get better faster. Um, yeah, so they'll just call out more. I think for children and families, again, this is a matter of life or death, and not, having a place to send your children for school and for care. It puts the future of our country at risk, like them not having access to childcare and even the threats of like Head Start being cut. 90% of a child's brain is formed by the age of 5. And so, if we are removing the opportunity for them to have valuable, meaningful social and academic interactions during that time frame, you take that away and you're replacing it with what's likely an environment of chronic stress. You put that together and it's really not looking good for our future as a country, as a global community. When you think about how these will be the adults that we're hoping will innovate change for our future and solve our problems, but they're starting off with a major deficit in development. So it's a lot to consider. If I could change one thing, I would make the information more easily accessible, streamlined, and easy to understand. We have to remember that about 21% of adults in the United States in 2024, 2025 are illiterate, and about 54% of adults read at or below a sixth grade level. Um, and so the hoops that the people who need this information have to go through just to find the information and be met with the verbiage and the jargon that is there, it feels cruel, like it's unkind, like it was not intended for the people who need it the most. And at a time when they need it. You're searching for assistance for medical care, for food, for housing, for childcare. You're in a place of distress. Even the most educated person, if you put them in an environment where their basic needs are threatened and you're feeling insecure, your brain is not functioning optimally. So then you take a person who already has a very limited literacy level and you put them in this pressure cooker. You make them go on a goose hunt to access a website or a person who can help them. And then the forms that they're given, the portals that they enter are worded the ways that they're worded. Um, I think that dignity and ease could be added to the process of receiving help. Um, it can feel absolutely humiliating, and so I think that it should be streamlined, put all the links or pamphlets or whatever in one place, make it worded in a way that is way more easy to understand and to add various levels of accessibility. So even adding some video or audio options, a video walkthrough. What do you click on? Where do you go? What does this mean? And so, yeah, if I could, that's kind of a loaded answer, but if I could make one thing different before changing, before adding, can we make it so that we understand what is even going on and how we can access it? The reality is that this is hard and intentional work. It is an art and a science. People train and go to school for this. And it can be very grueling. I wish people would just stop to consider how much of a hard time they can have with their own children sometimes, and then think the educators in these classrooms are taking care of anywhere from 8 to about 20 children at one time with different temperaments, different developmental abilities, different preferences, pain points, all of these things. It's a lot to consider in trying to keep them safe, happy, fed, clean, and push them towards milestones and objectives and things like that, all while often getting hit, kicked, screamed at, sneezed on, coughed on. There's bodily fluids. You're tired, but the children are tired often or grumpy. Um, and it's a lot, and you're really, really in it for the love of the children, the love of the families, the love of the work, but it can feel very, very thankless. Then you add on top of that, because of the state of the economy and the way the system is set up, it's not very financially, monetarily rewarding. And so some of the hardest workers that are there are really stretched thin because there are so many people who don't take the job seriously, who are not committed. There are call outs, people showing up late, people leaving early, quitting left and right, the turnover. And so the ones who are dedicated and who show up all the time, it's not fair for them. But then you almost can't even blame the ones who don't show up all of the time because outside of the love of children, why would they? You're not getting paid very well at all. There's often not insurance at all or not a good option for insurance. Then you're being critiqued by licensing. administrators, parents who are, kind of talking down to you. It's really hard, especially when on a national scale, we're asking more and more of these professionals, degrees, experience, going through different types of observations for quality assurance and being coached and things like that. But the pay is not increasing to match that level. And so, another reality that I think policymakers and society at large needs to understand is I will not be surprised if this field implodes sometime soon if we do not figure out a way to compensate appropriately. This is not sustainable. Again, just going back to wording the policies in a way that's easy to understand. I don't think it's very kind or fair to create a lot of these very um im- like substantial policies that change people's lives in a major way, but they don't even make it so that people know what's happening to them. um and so then one other thing would be to just consider the whole person when you're making these policies and these changes. A lot of these systems work together, and so if lawmakers could be conscious of supporting the whole person and the whole family and seeing how it all works together. It's not really fair to ask someone to show up in a certain way if they don't have access to food. Okay, you get them food, but if you don't give them access to a doctor or mental health care or time off, okay, they've got a job. The job is paying well. They have insurance. The prices are coming down, but you don't give them any time off ever. So they're still not sleeping. They're not resting, they're not on what there's just so many things that connect. And so just to remember those things, word it in a way that people know what's happening and consider that there are so many factors at play.